I have seen certain scenarios where a member may think that a certain specialist may be in network because they go on the website. Double check before seeing that provider. Therefore, you're not surprised with an unexpected bill.
Welcome to Under the Coverage.
During each episode, we interview people, sometimes it's just each other,
who spend their working days focused on health benefits and health care.
As consumers, we want the same thing you do.
We want the entire system to be less complicated.
Our guests share insights about how they navigate healthcare and the health benefits systems. I'm Jolene Myers.
And I'm Sarah Flusky.
And we're ready to lament,
complain,
empathize,
and maybe help a few people.
Today we are joined by Alicia. She works in client services and has spent the last 4 years working in the benefits industry. In her role, she works with human resources teams and brokers to ensure a positive benefit experience for employees and their families. Even as issues arise, and anyone with a benefit plan knows they do, Alicia works internally to help resolve problems quickly. We asked her what she wishes more people with health insurance knew. She wishes people knew that health insurance is not as scary or complicated as you may think it is. That's not to say it's easy, but it's possible to learn. And we're here to help with that today.
Alicia, welcome to the podcast.
Hi, thank you for having me.
Thank you for joining us. So we invited you here today to talk to us about medical networks and reading your ID card and the overview of your benefits plan, how that relates to your ID card. And we know that understanding the information on your ID card is really helpful when it comes to knowing who to call and helping the provider's office find you in their system to make sure you get billed the right way. But it's very important to understand the benefit plan that you have and how those things work together. I feel like understanding those and talking to you before, knowing both of those things together, your benefit plan and what your ID card is telling you, is this kind of superpower for getting the most out of your benefits and using the healthcare systems effectively, at least from a cost perspective. So first, talk to me a little bit about the benefit summary. Why is it important to understand that, or at least know where it is so you can read it?
Yes, so to start off, it is very important to know your benefits just because it all comes down to the out-of-pocket expenses, you will have. So in order for you to have the lowest possible out-of-pocket expenses, it is important that you understand what your summary benefits are as well as your network.
The benefit summary should show how much you're paying for services, a percentage or a flat fee, and then in-network and out-of-network benefits if you have out-of-network benefits.
Yes, that's correct. And it's important to know that not all the time you will have out-of-network benefits, which again ties back to making sure that you understand your benefit summary as well as reading your ID card to ensure whether there are out-of-network or in-network benefits. Especially when it comes to routine services. A lot of the times, some of those routine services may or may not be covered out of network. So it's important to understand your benefit summary to ensure that those services that are supposed to be covered at 100%, that you actually do get them covered at 100%.
So how would you know for plans, because not every plan has an out-of-network benefit?
For starters, you want to make sure that you understand where your network logo is on your ID card. Typically, it's on the front of your ID card. That is going to tell you what your primary network is. Therefore, that should steer you into ensuring that any provider you are seeing is within that network. And if you are unsure, at the back of the ID card, there will be a customer service number that you can call to ensure that the provider you are seeing is within that network. And then in regards to out of network, if you are unsure whether, there are out of network benefits, it's typically on the back of your ID card. It will let you know, kind of similar to the front, the primary logo, it would be in the back. But again, you just want to make sure that you do in fact have those services covered. Otherwise, unfortunately, you may be paying out of pocket for the full expense.
I think it's important to note too, there's a phone number and call it. And we've mentioned that a few times, but sometimes if you're opening up that benefit summary and it still is confusing to you, you can call that number and say, I'm having this done. I'd like it at this location, whatever. And they can explain that to you, right? I mean, I'm sure you kind of field questions like that sometimes as well.
Yeah, definitely. I mean, that's the reason why we are here as, why we have our customer service team open 12 hours a day, just so that, we're able to make this health insurance easier for you and make sure that, you're not paying so much out of pocket, because at the end of the day, we want to reduce those costs. We don't want you to have to pay more than you have to, especially for services that are supposed to be covered at 100%, for example, routine services.
If you have an annual physical, you want to be sure to go to an in-network provider to have that covered at 100%. If the provider is not in that primary network, even though it's something that should be covered at 100%, it wouldn't be, because it would be an out-of-network provider.
That's correct. And unfortunately, sometimes people may assume that the provider is a network, or they may assume that, oh, well, it's a routine service. It's got to be covered at 100% regardless. And then, they see the provider, turns out that they were not a network because they, assumed that it should have been covered at 100% regardless of the in-network, out-of-network. And now they have to pay out of pocket for a service that could have been covered at 100%.
So, Alicia, outside of routine services that would be covered at 100% if you went to an in-network provider, if you went to see a specialist, if I went to see an orthopedic because my leg has been bothering me lately, I know that there's going to be either a copay or I'm going to have to pay a percentage of the cost of those services, depending on my insurance. How can I use my ID card there to make sure I'm picking the right specialist?
So you definitely want to, for one, check to see if you have a deductible or if you don't have a deductible, because typically the majority of services that are not routine may have a just certain deductible you may have to meet first. And secondly, you want to check the network. Again, this relates back to what we were just talking about, the importance of checking the network. You want to make sure that the specialist you are seeing is within your network. That's why, we refer back to the customer service phone number to give us a call so that we can ensure that that provider is a network. I have seen certain scenarios where a member may think that a certain specialist may be a network because they go on the website and they see that certain office is a network, but not all the time is that accurate, because there's only certain providers within that office that are a network. And you want to make sure that you double check, before seeing that provider. Therefore, you're not surprised with a, unexpected bill.
I think that's a really good point, because I don't know that if you don't work in the health benefits industry that you would necessarily know that if I wanted to go to ABC Orthopedics and one provider is in the network, it doesn't mean all of those providers are in the network. So the offices will enroll those providers independently. And that's because providers might come and go, right? So you bring in a new provider. Now the provider's office has to work to get that person covered in the network with all the networks that they take.
Exactly. Yep. Because not all providers are credentialed. Sometimes they may not want to be credentialed with that certain network, and some providers, may be. So although you may see that, ABC Orthopedic office is a network, it doesn't mean all providers within that ABC network are a network.
That's a really good point. That's a really good point. So for the most unplanned of things at all, let's talk about emergency room visits and network. So between your benefit summary and your ID card, when you're thinking about emergency services, what do you need to know?
Well, for one, in an emergency situation, we don't want you to first think about insurance. We want to make sure that
fair.
We want to make sure that you get the health, the care that you need as soon as possible, especially if it's life-threatening. We don't want you to be in the ambulance calling, Nova, hey, is this going to be covered? We want you to make sure that you first take care of yourself in an emergency situation, and then we'll figure out the rest. In regards to an emergency situation, obviously, unless it's life-threatening, you kind of want to ensure that the health concern you are having is in fact an emergent situation, because majority of the plans that we have, the emergent and non-emergent services do differentiate quite drastically. So you want to make sure that you are going to the ER when it is life-threatening. For example, I've seen a scenario before where a member has gone to the ER and the claim came in and it was for a strep throat. You can either call your primary care provider and see if they are able to, either get you in for a visit or prescribe you some antibiotics. Or you could even go to an urgent care, because the price there is also quite less than in ER, especially because more than likely that strep throat ER visit is going to come in as non-emergent. Therefore, that is a lot more money out of your pocket that could have been prevented.
You said it before I got a chance to even say this out loud. I know I have been to the emergency room for perhaps non-emergencies. And it was an emergency to me if there are other options available, like telemedicine, or I know a number of our clients, their membership has access to a 24-hour nurse line. So they can call if the provider's office isn't open or you can't get through in an emergency line to a provider's office. I feel like a lot of them are very good about following up. If you call there, they have answering services and things. Between all those things and urgent care, like if none of those are an option, you're left with the emergency room. Or you said, if it's truly a life-threatening situation.
When you look at the price tag associated with some of these things, it becomes very clear that this all plays into driving up healthcare costs and premiums.
Yeah, definitely. And I think a lot of people too, they may think that in ER, if I go to the ER, I know I'll get taken care of right away, so I don't have to deal with the strep throat any longer. But like, Jolene just said, if you look at the price tag, going to an ER when it's non-emergent versus going to an urgent care, it's very, very different. The price, changes drastically. So if you are able to wait and if you are able to get care and, whether it's a PCP or an urgent care or telemedicine, that's definitely the route to go, because at the end of the day, we don't want you to have to pay out of pocket for certain expenses that, did have other options and they were at a much lower cost.
I think especially since there are so many plans now where there's a high deductible or there's more, I want to say you feel more of your dollars at risk when you go for services, that because we have more of these options, it makes it easier. I mean, urgent care hasn't always been around, at least that I've been aware of. So to know that there's still an option to get something taken care of, but understanding it's going to be at a cost that will be higher than telemedicine or talking to your primary care provider or calling them, after hours and speaking with somebody on the phone to get some direction. There's a whole bunch of steps you can go through before you end up at the emergency room. Well, this is great. The ID card and the benefit summary and kind of knowing those things and then leveraging the people on the customer service team to be able to ask the questions to confirm that you're going to see the right place at the right time at the right cost. I think that's really what we want people to get out of this conversation.
Our goal is for you to not spend so much out of your pocket.
Thank you very much for joining us, Alicia. It is always lovely to talk to you.
Thank you for having me.
This podcast was brought to you by Nova Healthcare Administrators.
Do you have a question or a situation you'd like advice about?
You can find us on Twitter at UNDR The Coverage.
If you're into email, you can reach us at podcast@novahealthcare.com.
Don't forget to leave a review, give us a like, or subscribe, but more importantly, share.
We'll find the insiders. You share it with the outsiders.